all, I'd like to thank you all for coming today, for spending some time so that we can educate you a little bit more about women's health in general. In our group in SOG, we hope to empower ladies with enough knowledge to know about their own health and when to seek help whenever necessary. Okay? We also hope that you have collected your goodie bags filled with all our exciting products from our sponsors, namely GSK, MSD for the cervical cancer vaccination vaccines, Bayer Healthcare for the birth control pills, Asian Genomics for genetic screening, Menarini for treatment for endometriosis, Neo Asia for laser vaginal rejuvenation, and our sponsors from UOB Kenya. So thank you to our sponsors, without which wouldn't be possible. We would also like to bring your attention to the SOG screening package flyer and the evaluation form inside. Kindly fill out the evaluation form and return it to our friendly staff at the SOG booth. Okay. To start off the forum, I would like to invite Dr. Lee Kin-Wai to the stage. Okay, a little bit more about Dr. Lee. Dr. Lee is an experienced consultant, gynecologist, and obstetrician. He is also the founder member and the executive chairman of our group. Dr. Lee has dedicated his services over the past 3 decades and continues to practice ONG up until this very day. In fact, all of us are running clinics before coming to this forum. Besides providing pregnancy care and delivery services, Dr. Lee is very passionate and highly skilled in endoscopic work, specifically hysteroscopy, laparoscopy, and has an interest in laser vaginal rejuvenation as well. So without further ado, Dr. Lee, please.
Thank you, Natalie, and thank everyone for coming and spending the Saturday afternoon with us. A little about our group, SOG in short, stands for Singapore Obstetrics and Gynecology. Many of us actually in this profession for 20, 30 years, but in 2011, we organized ourselves, corporatized as a group, and in early this year, we were listed in the Stock Exchange of Singapore as a public listed company. I'm the chairman of the group, and I have amongst my group very distinguished doctors, Dr. Radhika, who is prominent breast cancer surgeon. Now breast cancer is a very specialized form of medicine art, and we call her actually a oncoplastic, means cancer and plastic surgery to be carried out at the same time in suitable patients who has got breast malignancies or breast cancers. I skip that, that's me. There's Dr. Hing Tung-an. Dr. Hing that delivers one of the top obstetricians that delivers probably the most babies in Singapore year in, year out. Then I have the charming Dr. Chua, my partner in Banish Hospital. She'll be a speaker later. And a very good friend of mine, Dr. Banish, also a very skilled laparoscopic surgeon. Dr. Cindy Pang, she specializes in gynae oncology, that means the malignant side of things. And of course, our young rising star, whom you just met, Dr. Natalie Chua. Our clinics are in Gleneagles in Central. The latest setup is in Mount Elizabeth Novena Specialist Center. Then Dr. Bay anchors in Thomson Medical Center. Dr. Chua and Dr. Hing has clinics in Parkway East Hospital and Cassia Crescent. And our aim basically is to improve the health of women and educate the public with regards to healthy lifestyle and preventive medicine. Continuity of medical care for our patients, which I think is one of the reasons why I started this group, so that there's continuity care even after senior people like us have retired. So patients wouldn't feel as if they are medical orphans, going around hunting for doctors. So there's a continuity of care in our group. And of course, it's part of the succession plan, not just to look after patients, but continuous skills so that we can pass on to the next generation, younger and probably highly skilled and more learned doctors. Now, people always get mixed up. What's an obstetrician and what's a gynecologist? Today, definitely we're dealing with gynecology. Gynecology actually deals with looking after the diseases of young ladies, grown-up ladies, and not so young ladies anymore. So we're looking at things like pap smear, cancer screening, cancers, menopausal symptoms, fibroids, and all the surgical and medical problems that we dealt with in a lady who is not pregnant. So when you see us as an obstetrician, means we're actually looking after babies in ladies who are pregnant. So there lies a difference. So today is a gynecological forum. So just to reinforce, obstetrics means looking after ultrasound scan. That's my partner, Dr. Chu. In antenatal checkups and all, and providing what necessary care there is for the mother and the baby. And then, of course, we always hope to see a healthy newborn baby. This is the baby, and this is also our baby in the room. And this is something which I like to share with you with a very successful public forums. Even today, we are actually overwhelmed, overbooked, and it's my sincere apologies for those of you who has to be turned away because we just cannot accommodate in this small room of ours. And we actually have another secondary room which the hotel has kindly given to us. Even that is already booked and filled. So my apologies for those ladies who can't get into this forum. This was done last year with a full house again, just like today. And this is some of the activities last year. Again, we have little exhibits and booths and all this. So do feel free to visit the booths and exhibits, and they will offer you whatever takeaway gifts and all this. And this is complimentary by the sponsors. Our group of specialists work with most private hospitals in Singapore. We are not employed by any of them. Some of us are still visiting consultants to restructured hospitals. Hence, the information given today is from the best practice standpoint and in your best interest. And I would like to thank the following sponsors again: Bayer, Asian Genomics, GSK, Menarini, NeoAsia, MSD, and UOB Asia. Without further ado, I would like to hand over to the first speaker, who is Dr. Natalie Chua, and the topics covers Know Your Flow, Banish Your Money Woes. Dr. Chua specializes in obstetrics care, which includes preconception health screening, gynecological cancer screening and prevention, and the management of common gynecological problems. She is renowned for her caring demeanor and is objectively passionate in providing the best obstetric and gynecological service to her patients. Without further ado, let's invite Dr. Natalie Chua. Thank you.
Alright, thank you very much for that warm introduction. Okay, so today we'll be talking about Know Your Flow, Banish Your Money Woes. And why did I name it that way? Know your flow. You need to know what a normal menstrual cycle is. If you know what's normal, then we can tell you what is abnormal. And when you do realize that there's something wrong, okay, there is available treatment so that we can help you cope with your symptoms. Unlike in the past, many people suffer in silence with this condition because they thought it is normal. So much so that I had a lady who was bleeding every month without fail, quite a fresh, heavy amount of bleeding. So much so that she landed up in the hospital because her blood counts were so low that she needed a blood transfusion. So I asked her, why didn't you come and see a doctor earlier? Oh, because I thought it was normal. Okay, so today I hope to educate you, and when you go back, spread the word to your family members, you know, what is normal and what is not. Okay, so starting off, okay, we'll talk about some myths that we have. Everybody has a certain conception about things, you know, whether it's real or not. Okay, and to see globally what the problem is. Okay, this doesn't affect just Singapore alone. You know, every lady in every country has to go through this cycle. Okay, you need to know what is normality and what can go wrong in the cycle, and what are the different causes of heavy flow, painful flows, and irregular cycles. Okay, lastly, I'll end off by treatment. Okay, so we've all heard some people say something about menstrual cycles, but is it all true? my job will be, I'll be seeing much more patients. So answer is false. Okay. So conversely, if you eat hot food, it will decrease the flow. Well, you know for a fact that it can't be true, right? All right. Okay. Having heavy periods is normal because it cleanses the system. Okay. Once you have the flow, wow, your body is clean for that period of your time until 1 month later, not so clean, and it comes out again. Okay. Okay. The thing here is the word heavy. Okay. Well, heavy flow isn't entirely normal. Okay. The flow may be heavy on the first day, second day, but by week off it tapers off. Okay. During the menstrual cycle, how many milliliters of blood do you think you use? 100, 200. Studies have shown actually an average lady only loses about 35 to 40 mils of blood, which is, if you think about mineral water, it's just literally the bottom only. Alright? Okay, that is the amount of blood you actually lose in the actual cycle. Okay, another myth. Doing regular exercise during your period will help relieve cramps. True or false? Sounds plausible, okay, and it's really the case. Okay, it's true, alright? Okay, helps with your stamina in general, helps you cope with pain a little bit better, psychologically maybe a little bit stronger as well. Okay, so that generally helps. Okay, having very strong period cramps and pain each time is part and parcel of the cycle. So day one, you're lying in bed, crawling up like this lady with a hot water bottle there. Okay, is it true or false? Okay, yes, everybody's right. Okay, false. Okay, the key word is also this word, strong period cramps. So to a certain extent, it is a little bit painful. So if you're every month, every month, you're lying down, you can't go to work, you can't go to school, that certainly cannot be normal because it's affecting your quality of life. Okay, PMS, premenstrual syndrome, is not real. It's all in the mind. Is it true or false? Okay. Yeah. Okay. PMS is a real thing. Okay. To some people, it depends on how you cope with it. Okay. All right. But then there's also an entity of premenstrual syndrome where it really affects their quality of life, and there are different forms of pills to actually help with all these symptoms. Okay. The truth about our periods. Okay. So I want to highlight to you about a global survey that was done over 15 countries involving about 6,000 women from different age groups, from the adolescents to the teenagers to the working individuals and the older ladies as well. And the purpose of that study was to get an understanding about what a woman thinks, okay, about their periods, their knowledge, their attitudes, and how they perceive it to be. And the results show that 1 in 3 women at some period of time has heavy periods. Okay, just in this room alone, there's about maybe 100 people in this room, which means about 30 people at least will come to me complaining about heavy periods. But I don't really see that many patients in my practice. Okay, a lot of us don't really seek help. Okay, even though we do have heavy flows. Okay, 75% said that it made them feel less attractive and sexy. I can imagine when you're having your periods, the clothes that you wear probably going to be a little bit baggier because of the bloatedness. Okay, and more than 60% tend to avoid social engagements when they are having heavy periods because it's uncomfortable, and understandably so. Okay, but should it really be so much? Okay, just to highlight that it can really affect our daily life. Okay, for younger girls with heavy flow or painful flows, it can affect their attendance at school or even their work performance. Okay, it affects the type of clothes you wear. Okay, when you're having a period, ladies tend to shun away from white, understandably so as well. Okay, it will affect your sports and fitness activities. Maybe during that period of time, you don't really want to go to the gym too much because it's quite hard to exercise. Okay, and I certainly see a lot of ladies who come to me to ask for pills to delay their periods because it will affect their travel plans. Okay, if you're a working housewife or mother, okay, you have to do everyday chores and you have to participate in social events. And if you have heavy cycles, that's going to affect your quality of life as well. Okay, and what goes in the bedroom is going to affect your relationship with your partner and sex life. So much so that sometimes when I got patients who I ask them, when was the first day of the last menstrual period, then they can't remember. I turn to the husband and say, when was the last time around? Oh, just last week, okay. Because they remember it as well. Okay, it really does affect them too. Okay, about 50% means 1 in 2 ladies. Okay, they perceive that heavy bleeding is a normal part of a period. Okay, but that's the way they were brought up to know how the periods are. Okay, 1 in 3 ladies, okay, have not consulted a doctor because of their heavy flows. And 41% thought that there was no treatment available. Okay, and my job today is to change all these numbers. Okay, so that you know that having heavy and painful flows is not entirely normal. That you should seek a doctor when this thing happens. And lastly, there is treatment that is available. Okay, we talk a little bit about menstrual cycle. Remember I said you need to know what normal is before you know what abnormal is. Okay, so a woman's body goes through these monthly changes. Okay, and what's the purpose of having all these periods? Okay, basically it's a sign of fertility. Okay, during every month, 1 egg is being released. Okay, and if you conceive during that period of time, you get pregnant. Alright, so the body prepares the womb, okay, in the anticipation of getting pregnant. Okay, just remember that everybody is not the same. Okay, the duration, the flow, the regularity isn't the same for every lady. It can range. Okay, some patients have periods once every 3 weeks. Some patients have periods once every 5 weeks, and that can be perfectly normal. Okay, your cycle can reveal a lot about your health. Okay, the fact that a lady has a regular cycle, normal flow, means that all her body functions are intact. The connections from the brain to the female reproductive organs, all the way to the individual organs itself, shows that that is functioning within the healthy range. Okay, a little bit more about the menstrual cycle. Okay, the menstrual cycle starts off from the brain. The brain releases certain chemicals, and when chemicals are released, okay, it will stimulate 2 cycles. One is the ovarian cycle, the other is the uterine cycle. A little bit of biology 101 for everybody. This is the womb. Okay, this is where every month, okay, the lining of the womb is being shed to become your periods. Okay, and this is the ovary. The ovary is where the eggs are being stored. Okay, and a lady is born with a certain number of eggs. No way to increase it, no way to decrease it. Okay, this is what we have. Alright? So every month in the ovary, okay, there's a little egg that grows and grows until one day, it pops. Okay? After that it pops, okay, the lining of the womb, which was initially very clean because the menses has just ended, so the lining of the womb is very thin. Okay, in anticipation that an egg is going to be released, it builds up. It builds up and builds up until, let's say the egg is not fertilized, there's no pregnancy, it bleeds. Alright? Okay, so this is the whole cycle. Okay, and both these cycles have to be coordinated. Okay, you will hear a lot of things about hormonal imbalance and things like that, which is very common in ladies. Okay, and the imbalance is as a result of this cycle not talking to this cycle. Okay, which is why the periods are irregular in some patients. Okay, so we talk about normal. Okay, what is normal? Okay, on average, a lady bleeds for about 5 days. Okay, but this can range all the way from 2 days to a maximum of about 7 to 8 days. Alright? Okay, so in that sense, some people have a regular 3 to 4 day cycle. Some people have a regular 1 week cycle. That's perfectly fine. Okay? How often should it be? Okay? It can range from 3 weeks to 5 weeks. Anything less than that and more than that will be considered abnormal. Okay, amounts, as I said, the average blood loss is only about 35 to 40 mils. So how is it possible that we need to change our pads quite a fair bit? Certainly must be more than that. Remember that a major component of the menstrual bleeding, so to speak, is actually the lining itself. So you're not just bleeding blood only, you're bleeding the lining of the womb, which also comes out during your periods. Okay, and most of the blood loss usually occurs on the first 2 to 3 days of your period, after which it tapers off. Okay? Okay, sense, usually the cycles are quite regular. Okay, but we're not perfect. Doesn't come on the same day all the time. Give and take a few days in between. So plus minus 5 years will still be considered fairly regular. Okay. So anything abnormal would be beyond this 5-day window. In fact, I'll probably tell patients if it's within a week of your expected period, it's usually quite fine. Okay. So what is abnormally heavy then? Okay. Abnormally heavy would be when the amount is more than 80 mils. But of course, we can't measure, how many mils are we bleeding or anything like that. Okay, these are the studies that are done on the scientific papers and things like that. Okay, but more importantly, what are your symptoms? Okay, so if the lady changes her pads or her tampon every 2 hours, and without fail, every 2 hours it's fully soaked, okay, the lady could be bleeding a lot. Okay, sometimes you even have to wear double layers, okay, just in case. Okay, because there have been incidences in the past where, let's say, you stain yourself. Okay, if on average for each cycle they use more than 20 pads fully soaked, that would be considered quite heavy as well. And some ladies even have to wake up in the middle of the night to change their pad. Okay, that would also be considered a little bit on the heavier side. Probably better to see a doctor, evaluate, make sure nothing is wrong. Okay. Another symptom is called flooding. Okay, flooding is when you sleep and then you wake up, you're covered in a pool of blood. Okay, so that's a symptom that some of my patients explain to me as well. Okay, to a certain extent, some ladies do have blood clots, it's normal. I have blood clots myself. Okay, but when they are too big, more than 1 inch in diameter, maybe you should check to make sure there's nothing wrong. Okay, and I think this aside and everything, I think the more important thing is that it affects your quality of life. Okay. You should certainly see a doctor to make sure everything is okay. When you see us, it doesn't mean that we're going to say, oh, you got this problem, that problem. For all you know, there's no problem at all. At least you know that there is nothing wrong with you. Okay? Visually, sometimes I ask them, okay, is it just a little bit of staining, moderately stained, or is it fully stained, the pad? Okay, and nowadays quite a few ladies use tampons, so is it just, partially soaked, or is it fully soaked? Okay? Do you need a big tampon to, plug the hole, or you can just get away with a little small one? Okay? We also go through the symptoms. Okay? You have to change every 2 hours. Okay? You sleep on white sheets or wake up with a large red patch. Okay? Or do you have to use 2 pads? Or whether you need to have painkillers to relieve the pain. Or sometimes you don't even dare to get out of the house because you're afraid that there might be an incident. Okay, so these alert you that something may not be quite right. Okay? Sometimes because of the excessive bleeding, some people have very low blood counts. And the signs and symptoms of low blood counts will be being excessively tired, having shortness of breath, or having dizziness. Okay, so that could be a sign that the blood counts are low. Okay, nowadays we got lots of things to help us. So I was just Googling, and there were so many apps that's available these days, so much so that you can track your periods based on that. They'll calculate your cycle lengths and things. In fact, most of the time my patients let me see their app. Okay, so when do you have a problem with your period? Okay, when there are 4 things. When it's excessive and heavy, when it's prolonged, meaning more than 7 days, okay, when it is irregular, okay, you cannot predict when it's going to come. It can come within 2 weeks, it can come within 3 months. You can't tell, all right? Or when it's excessively painful. Okay, so we go through the causes, all right? So number 1, the hormonal imbalance. Remember I was telling you about the ovarian cycle and the uterine cycle, how they must match one another. Okay, I also akin it to, for example, like playing in a music like an orchestra. Okay, you've got the conductor to say, okay, everybody start playing. Okay, the conductor starts. That's the brain. Okay, that's the brain sending off the signal saying that, okay, it's going to happen. Okay, then you've got the people playing the flutes, okay, and then somewhere midway, you get somebody who will play the, what else do they play? String instruments, violin, okay, and then forward towards the end, pang, you get the drums, okay, and that's it, you have your period. Okay, so similar to that. So one must happen before the other, okay, and then the finale. What happens if everybody plays at the same time? you get nonsense music, right? Okay, okay, so that's what happens in irregular cycles or in excessively heavy flow. Maybe the hormones are not talking to one another, they're not coordinating their actions, and that's why you have all these symptoms. Okay? A thyroid is a gland down here. It produces certain hormones, and sometimes abnormality of the thyroid gland can also manifest itself in menstrual disturbances. Infections of the womb or the neck of the womb can also cause heavy flow. Okay? Sometimes there may be a growth inside the womb. Okay? For example, fibroids, which I'll talk about a little bit later, polyps or cancer. Okay? I also go through a medical history to see what medicines you're on. Certain types of medicines can prolong bleeding, okay, and that may cause heavy flow as well. My own mother, who is on a blood thinning agent, every month without fail she would have excessively heavy flow, okay, because of this blood thinning medication. Okay. Other problems to exclude, especially in a young person. Young people, they don't usually get terribly heavy flows. But if a lady young girl without fail gets quite heavy flows, sometimes we must think whether there's any inherited blood condition that results in her blood not being able to clot. Okay, so we talk about the growths, okay, and this is what we see in our practice quite a fair bit sometimes, okay. So this is the normal womb, okay, but you see all these white layers of muscle down there. These are known as fibroids. Fibroids are extremely common. I think out of every 4 ladies, 1 or 2 ladies will have a fibroid. But do all fibroids cause problems? Not necessarily. But some of them can grow until very big, okay? Or some of them can grow into the lining of the womb. And in those cases, this can cause menstrual problems, okay? Polyps are extra growth of flesh. So you see the red fleshy material down here? Okay, so this is an extra growth on the lining of the womb. That's why it causes the heavy flow and the painful flow as well. Okay? Sometimes, okay, instead of the menstrual blood flowing out, some of them can kind of accumulate in the wall of the womb itself. And over time, the wall of the womb can become bigger, larger. The womb can enlarge due to this condition known as adenomyosis. Okay, this classically actually causes very painful and heavy flow, especially in ladies in their the perimenopausal period in their 40s. Having said that, I've seen some young girls with very bad cases of adenomyosis as well. Okay, endometriosis is where the blood kind of accumulates over the ovaries. Okay, and that can result in painful flow. In fact, in a young girl who's thinking of conceiving, sometimes it can even cause infertility. Okay. There's also, but of course, when you see a doctor, what do you want to exclude? We always want to exclude cancer or precancerous changes, okay, which Dr. Park will talk about in a short while. Okay, so painful periods, how painful should it be? Okay, so basically anything that affects your quality of life. As I said, to a certain extent, cramps are, some ladies do have mild cramps during the first day, second day or so, especially when the flow is heavy. Okay, but if you have to take a painkiller regularly, if you're missing school, if it's so painful that you literally have to pass out, you really should see a doctor to make sure everything, there's no cysts or abnormalities in the womb. Okay, painful periods, okay, across the age, okay, from a young girl to a middle-aged lady, okay, to one close to the menopause can be due to different reasons. Okay, in a young girl, okay, sometimes it could be a structural problem. That means fundamentally there's something wrong in the development of the womb, and as a result, she has a lot of painful flow. Or it could just be there's nothing wrong with her. That's just the way it is. The only way to know is to check. Okay, it's not to Google. It is to come to your doctor for a clinical assessment so that we can do the appropriate investigations. Okay? In the reproductive age group, we always think about pregnancy. I know it sounds silly. I'm talking about painful periods, and you say, am I pregnant or not? Okay, but just yesterday, I saw a lady who came to me she was bleeding for 3 weeks, and the day before she saw me, it was excruciatingly painful. And that was symptoms. Bleeding for 3 weeks together with pain. And then lo and behold, when I did a scan, there's a pregnancy inside. Okay, so, it's something in that age group, we want to always exclude. Okay? At the age group, sometimes you're exposed to certain viruses or bacteria that can cause painful periods as well. Okay? And sometimes there is a collection of a blood clot within the ovary itself, which can cause painful periods. Okay, closer towards the menopause age, okay, the womb can get a little bit more swollen, resulting in heavy flows and painful flows, and endometriosis may also be present in these patients. Okay, the causes of irregular periods is very much similar to what I've mentioned just now. Okay, blood disorders, hormonal imbalance, okay, abnormalities in the structure of the womb itself. Okay. Okay, but now we go into treatment. So after we know all the causes, okay, then we can treat you effectively. And obviously the treatment will be based on what is the cause of the underlying condition. Is it due to a growth, or is it due to a hormonal imbalance, or is it due to a blood disorder, or maybe it's that medicine that you're taking. Okay? Okay, anyway, in terms of treatment, it can be divided into two arms. We treat you medically, medication, injections, okay, or we treat you surgically. Okay, not every case has to be operated on. Okay, so in case you think you see doctor, the doctor is going to jump on you and operate on you, most of the time we're not like that. Okay. Okay. In terms of medical therapy, okay, it can be non-hormonal or hormones. Okay, but before I go into that, the surgery per se, okay, we will only do surgery when it's necessary. Okay. For example, if we see a cyst in the ovary that is causing the painful periods, in those cases, then yes, sometimes we would recommend medication, we would recommend surgery to remove the cyst. Okay? If we see a polyp that is in the lining of the womb, it can be removed very easily from a scope down below, known as a hysteroscope. Sometimes fibroids might be the cause of the heavy flow, okay, and that can be removed as well. Okay, and last but not least is a hysterectomy. In cases where all else have failed, sometimes we have to remove the uterus altogether. Okay, but more often than going to surgery, we will treat you medically first. Okay, and a lot of people are scared of this word, hormones. It's like a taboo word. Okay, so sometimes we will go on to simple painkillers first. Okay, to relieve the pain, and it can help decrease the flu as well, before we go on to the hormones. Okay, and before I go on saying about these hormones, and it sounds so scary and everything, remember that there are a lot of hormones in our body, and the reason why everything functions is because everything is timed in a perfect order, and we only institute treatment when things don't go according to order. Okay, every drug has a side effect. Okay, there's no drug that is perfect. Okay, but you need to weigh the pros and cons before deciding whether this treatment is suitable for you or not. Okay? Even in terms of hormones, it can be delivered in many systems. Okay? It could be delivered in a pill form. Okay? It's also available as an intrauterine system. So instead of taking a pill every day, okay, you can put something inside the womb itself, and the medicine here acts locally into the womb. Okay, so that the bleeding gets less and it's less painful. Okay, or there are injections as well. Okay, that can also prevent the eggs from being released, and as a result, reduce the pain and the bleeding. Okay, so different delivery mechanisms. Okay, so pills, the IUD, okay, together with the injections. Okay, how does the pill work? Okay, the pill works by turning off your ovary, and why I put in inverted commas is like, oh, if turned off already, can turn on again or not? Okay, don't worry, it can turn on. Okay, it's very temporary. So much so that, let's say, lady wants to conceive, after they stop the pill, within the next month they can conceive already. So this is not in any way accelerating the natural aging process or anything like that. Okay, it's really the clever use of medication to manipulate what is not going on properly right now. Okay, or it can be a IUD. Okay, and IUD is good because the medicine, if you think about it, acts locally. You don't want the rest of the medicine to go into the bloodstream. Okay, so for certain ladies, okay, this might be a suitable alternative. Okay, the IUD actually thins out the lining of the womb, and as a result, you bleed less. Okay, and the periods are less painful because there's less bleeding, the womb has to squeeze less, there's less spasm, so there's less pain. So it's fantastic. Okay? In certain cases of endometriosis, okay, we have to kind of like shut off the brain altogether. Okay, so remember like the orchestra I was telling you just now, this is really, there's no conductor to begin with. So when there's no conductor, the band won't play. Alright? Okay, but even this is also temporary, okay? This will not induce it. This by turning off the brain function temporarily, okay? Some patients may have a menopause sort of reaction, okay, because it kind of stops everything just for a temporary, for a short period of time. Okay, but rest assured that it will go back to normal once the medication is completed. Okay, so more importantly, what can you do? Okay, these are what we do, that's the medical bit, this is our job. Okay, but what can you all do? First of all, is to be more conscious of what's going on in your body and keep a menstrual diary. Okay, remember the apps that I told you about just now? So exercise regularly, good in general for cardiovascular fitness. The diet. Okay, I suppose when you're bleeding more and everything, you could increase your intake of iron and vitamin C to increase your blood counts. Okay, whether to reduce salt or saturated fat, really there's so many postulations. I was reading through this medication, this diet, that diet, and nothing has really been proven to work. Okay? You can use a hot water bottle, okay, it will relieve the cramps to a certain extent. Okay, certain sort of massages may help as well to relax the uterus. Okay, and reduce stress in general. Remember that I told you that a lady's cycle tells a lot about a person. Okay, and let's say a person is very stressed, has poor diet, poor sleeping habits. Sometimes the cycles will be irregular. I get that a lot in ladies, for example, who are planning for their wedding before they're very stressed. Diet, don't eat, menses becomes a little bit irregular. Okay, so if you keep your body in good condition, that will help improve the situation. Okay, and then I think the last part down here is really important. Seek help. Seek help when there are problems. If there are no problems, please, by all means, stay at home. But if there are problems, you shouldn't be suffering in silence. Okay, so which one is good for you? You can see the young girl here. Okay, this one is a working individual and there's an older lady down here. Okay, let's say they have all these symptoms. Which door should they go to? Should we just observe? Should we do surgery? Should we give hormones? And really, everybody is different. Okay, menstrual cycles are different. The way we treat a patient is also different. Okay, first of all, we must know the cause. Okay, if it's a polyp, we remove the polyp. Okay, it's a hormonal imbalance, we give you hormones. Right? Okay? And the only way to know what the cause is when you see us and we do a workup for you. Okay, when we say workup, we don't mean for you all to work out and everything, but it's for us to investigate, do ultrasounds, maybe do a biopsy, maybe do a pap smear, okay, to make sure things are fine. Okay? We also see whether you need fertility. For example, if you're a young girl, no way am I going to ask her to remove her uterus, isn't it? Okay? But if it's an older lady who has tried every single door, okay, and all else fails, then maybe surgery might be a better idea. Okay, the key in all this is that everything is tailored according to the individual. Alright, we don't treat books. Okay, we don't tell you, okay, this is and then treatment is instituted. We always see how the patient is, whether she's a young girl, whether she can take pills, whether she wants to get pregnant as soon as possible, that sort of thing, before we institute treatment. Okay, so I come to the end of the talk already. Okay, so just to know your flow. Okay, do not dismiss painful and heavy periods as normal, because it may not be. Okay, talk to your doctor when in doubt. Okay, and they can be managed. We do have many forms of treatment that is available. And at the end of the day, we hopefully after this talk empower you with a little bit more information so that you can participate in terms of the treatment process as well. Okay? And also to help other women understand the importance of their menstrual cycles. Okay? It's okay to talk about periods. It's not something that we like to talk about, not the common coffee shop topic. Okay? But if there's a problem, speak to your girlfriend, speak to other doctors, they can help as well. Okay? And remember that you need to maintain a certain quality of life. I mean, right now, we're mothers, we're daughters, we're working individuals. Okay, we need to function daily. Okay, so we need to make sure that we're in the prime of our health. Okay, and with that, I